Hello, my name is Susie Mitchell, and today I'm going to be showing you the IVF fluid administration. So first and for all, I'm going to go demonstrate the parts of the IV tubing, perform hand and wash, wear gloves, take out the IV tubing from the packet. All right. So this is going to be the part, this is a spike, and this is where I'm going to spike the IV tubing to the solution. The drip chamber, this is going to be the solution, is going to be on how many drops per minute. This is the roller clamp to regulate to stop or the, the to stop or regulate the flow. And this is the white site. This is where I'm going to be connecting the IV piggyback, the IV medication. And this is going to be the adapter site. This is where I'm going to go connect the catheter site. All right. Okay, so now there's an order for the IV solution. So I'm going to go show you on how to prime the IV tubing. Okay, so I'm going to go perform hand hygiene, wear gloves. Okay, so I have my IV tubing here, the IV tubing, and this is my IV solution here. So take it out, spike, making sure it should not be touching the floor, making sure the roller clamp is closed. Okay, so making sure that when you hang it, it has to be 30 inches above the catheter site of your patient for adult patients. So I'm going to go hang it. Alright, so now I'm going to go hang it. I'm going to go press the drip chamber, making sure there's like 2/3 full. And I'm going to go open the clamp, roller clamp. So taking out the air, okay, making sure when you're taking out the air, there's no air coming out. Alright, so we have already removed the air. I'm going to close the roller clamp. This is to prevent air embolism for the patient. Alright, so now I have already primed the IV solution. So there's an order for that. So the order is 150 ml. So I have already checked in the MAR prior to that, and I have calculated it. So on 150 ml times 15 drops per minute is 2,250, and then over 60 minutes, 2,250 drops per minute over 60 minutes is going to be 37.5, but when we round it off, it's going to be 38 drops per minute. So I'm going to go to the MAR just to making sure the 5 rights of medications are followed, are correct. The right patient is Mrs. Eusebitadizone, the right drug is normal saline, the route is through IV, the dose is 38 drops per minute, and the start time is 0600. And now I'm next to the patient's bedside. Hello, Mrs. Dizon, how are you doing? Good. So the doctor has advised to administer IV fluid. Okay. And so, do you have any medication allergies? No. Okay. Can I have your name and date, your date of birth as also? Okay, that's good. All right. So now I'm gonna go start do the IV fluid administration. So I'm gonna go wear hand sanitize, wear gloves. Okay, and so I'm going to go connect it to the catheter side of the patient. And I'm going to go connect it to the catheter site. Okay, and making sure that I have, so when I'm ready, I have to open the clamp. Okay, so it has to be like 38 drops per minute. So I'm going to use my watch to check for 1 full minute. Okay. Making sure also that when counting it, checking for the patient's catheter site for any signs of redness, swelling, or any sign of infiltration or infection. And also after the 1 minute, check the patient. How is she doing? So making sure it has to be above 30 inches above the catheter site. Alright, so 1 full minute had passed and it's the correct 38 drops per minute. And so now I'm going to go put a sticker here. This is what the medication added. The name of the patient, the drug. It's going to be normal saline, added by my name, the amount, the day-to-day, and the IV solution through IV. Flow rate is 38 drops per minute. So everything has been followed here according to the 5 lines of medication. And I'm going to close basic here, okay? Alright, so the next one is there's an order for amoxicillin 250 milligrams, okay? So for that one, I'm going to go first. I have to prime the same thing I did for the IV solution. I have to prime it, okay? So I have to wear my gloves, hand hygiene, wear gloves, okay? So I'm going to go prime it, take it out from the new packet here. And so this is going to be making sure the clamp is closed. Okay, so this is my 200 milligrams of amoxicillin, and so when I hang it, the IV piggyback. So when I hang it to the IV piggyback, so making sure it has to be the secondary has to be above the primary. Okay, so. So when I hang it, has to be above the IV solution. Alright. Okay, so it has to be above, okay. So I'm gonna go spike it. Just to measure that one. Has not shouldn't be touching it, so this is where it's gonna be. Okay. So I'm gonna go hang it. Roller clamp is closed. Press the drip chamber, at least it's 2/3 full. Okay. And now open the roller clamp. Okay, take out all the air. Alright. So now I have checked there was no air. I have removed the air. Close the roller clamp. Okay, so that's what's gonna be. Alright, so now I have already prime it. So the order is I check in the medication administration record and I manually compute it. So it's going to be the order is 250 milligrams. So 250 milligrams in 100 ml normal saline. So 100 ml times 15, 250 milligrams in 100 ml over 50 minutes. So 100 ml times 15 is 1500 over 50 minutes. It's going to be 1500 over 50 divided by 15 is going to be 100 drops per minute. Okay, so I'm going to go to MAR just to verify the 5 lines of medication. The right patient is Macy's, there was a betadine. The right drug is amoxicillin. The route is IV fluid, and through the dose is 100 drops per minute. The time is 0800, the start time. And now I'm gonna go to the patient's bedside now. Hello, Mrs. Dillon, how are you? Good. Okay, so can I verify your name and date of birth? Okay, that's good. Do you have any allergies for medication? No, okay. I'm gonna go, there's an order for IV amoxicillin antibiotics to take out the infection, okay? So, and now I'm gonna go perform hand hygiene, making sure check the patient's catheter site for any sign of infection. So hand washing, wear gloves. So this is now, I'm gonna connect the IV piggyback. So this is since now it is the secondary, but it is above the IV, the primary. Okay, and now I'm gonna go making sure before you connect it, you have to wipe it with the alcohol swab. The white side has to be wiped with the alcohol swab. Here we go. Right, so now I'm gonna go connect it. Wipe it and then connect. There you go. And then open the rubber clamp. Okay. All right. So now I have to count it into 1 full minute, but since the skills kit says I don't have to 1 full minute, but I have to verbalize 1 full minute in counting the 100 drops per minute. It's going to be like fast dripping since 100 drops per minute. And now after that, I have to paste a sticker here, the medication added. So the name of the patient, usability 100 drops per minute. Okay, and then this is the drug amoxicillin, the amount to 50 milligrams added by my name, Suzy. The day-to-day, the base solution is through IV, the start time is 0700. So the flow rate is 100 drops per minute. So I'm going to paste it here. All right. So the purpose is whoever comes in here, they know what are the solutions, all the details on the medication added, okay? And so now I'm going to go check the patient, how is she doing? So, okay, so there's no sign of infection or infiltration, okay? And how are you doing? Okay, no complaints, no problem. Okay, that's good. And so now I'm gonna go remove my gloves, perform hand hygiene, and I'm going to the MAR and to document all what I have done today. So I have administered the IV solution according to the 150 ml of normal saline, and also the amoxicillin to 50 milligram has been added here according to the correct drops per minute, and through IV I have documented that one. And then the patient has no signs of complaint, and I'm gonna go check the patient later to see how is she doing. And so that is my video submission today. Okay, thank you. And then I have to call light next to the patient if she needs some help.